Healthy afternoon all of one, and namaste to chairperson. My topic is a little bit offbeat because it is not related to the yoga, it is more related to the Ayurvedic therapies or a Panchakarma therapy. Myself, Dr. Rahul Mandole, I work as a research associate with Madhavbag. Madhavbag is a Ayurvedic rehabilitation center for cardiac patients. Now, I'm just starting my presentation. Before starting this presentation, just let me know you all that why we have selected heart disease. Because as per the WHO verdict, India is going to be a capital of heart diseases by 2020. Now, as per the many of known journal, that it has mentioned that in a non-communicable disorders, heart disease is going to be a #1 killer. In current scenario also, as per the Jaipur Indian Heart Watch study and all, among the all non-communicable diseases, heart disease is contributed as a first choice of a killer. The present scenario of a mortality of heart disease, mortality due to heart disease in India is a 24.8, and if I compare this with rest of respiratory disease, it's 10. In TB, it includes 10.1. For cancer, it is 9.4. So, though I compare a cardiovascular disease with the oncology, cardiovascular disease is still a #1 killer in India. Now, if we compare to Western countries, we are still at a higher side. There might be a reason that we are a little bit lacking in the tertiary care. That is why, as per the recent lecture by Dr. Agwan, he suggests that we should come up with a new concept called shifting the task. That means the task what the tertiary care is taking care, that has to be shifted to the primary and secondary. So we have to play a role. Now let's start with the myocardial ischemia. Myocardial ischemia is something that is an imbalance between a supply and demand of oxygen to your myocardium. That is a reduced myocardial.
Can you go to the aims and objective, please? Because it's running time. Go to the aims and objective.
Okay, fine.
Otherwise, we'll not have time for discussion.
Fine.
You can skip all of this.
Yeah.
Go to your study part.
Fine.
Because the introduction of the subject is not necessary because all of us are in this field.
Okay. So, the aim on the objective of the study was to reduce the ischemia of a patient with a stable ischemic heart disease. And the selection criteria for this, that we have selected a patient with a stable angina, a stress test positive for induced ischemia, the time to onset of ischemia from 300 seconds to 600 seconds on a stable conventional medication. That was the inclusion criteria. The exclusion was the subject with unstable angina. We have specifically exclude the patient with the unstable angina, that is patient who had a ischemia or angina on a resting, ST changes on a rest, recent interventional surgeries, recent changes in a conventional medication, and age less than 30 and greater than 70 years of age, the pregnant and lactating woman, and contraindicated for the stress testing. Because the stress testing was the primary endpoint. With help of stress testing, the time to onset of ischemia, that means while the patient subject running on a treadmill test, the time on which the ST changes has been seen, that is the time of onset of ischemia, is the primary endpoint for the study, and the secondary endpoint was the heart rate recovery time. That means after exercising, in what time the heart comes to the normal condition. So this was the secondary endpoint. We started with our treatment, and that treatment part was with the Panchakarma therapy. On day 0, we start inclusion. After inclusion, the first follow-up was on a day 7 and the last follow-up was on a day 30. So it was a 30 days interventional study. So what we did for those subjects, one, we gave them a centripetal oleation, that is a snehana. Second, we gave them a thermal vasodilation, that is a svedana. And third is a per-rectal drug administration, that is a basti. With help of centripetal oleation, that may reduce the sympathetic activation. With help of thermal vasodilation, that may reduce a peripheral vascular resistance. And with help of a per-rectal drug administration, that is basti, in that we precisely took some medicines like a Gokshur, Haridra and Amalki. Those gave the result. They have proven that they can improve the extrinsic nitric oxide synthesizing by the endothelium, as well as they can facilitate the endothelium to produce its intrinsic nitric oxide. In this study, we include the patient with a CAD, that means a coronary artery diseases. Almost 2 were the LMCA, OM were 1, LAD 17 subjects were with a LAD, RCA 16 and LCX 13. Now, after intervention, what we have seen on a day 0, when we include the subject, their time to onset of ischemia was 414 seconds. On day 7, the time of onset of ischemia was improved to 483. That means there is a delay in onset of ischemia. On day 30, it was significantly improved to 561 seconds. So this clearly suggests that there is a certain delaying in time of onset of ischemia. At the same time, the hemodynamically, the patient was stable throughout the study. That might be because of we didn't change its beta blockers and other medicines. So that might be the cause. The hemodynamically patient was the same. Even his heart rate, his systolic blood pressure and diastolic blood pressure remain unchanged. The impact on the heart rate, as per the American Heart Association, some research paper they have suggested that if the heart rate recovery, if it is less than 15 beats per minute, that is going to cause more mortality. So that is why we include a heart rate recovery as a secondary efficacy endpoint for this study. And what we have observed on day 1, when we did a stress testing, on that day we found that the heart rate recovery was 221 seconds, while on a day 30 it was 171 seconds. So heart rate recovery was reduced significantly, that clearly showing that the patient is improving. And the conclusion, the ischemia reversal program, when administered as an add-on therapy to the conventional therapy, may improve blood supply to myocardium and reduce symptoms of angina to improve the quality of life in patients with stable ischemic heart diseases. Thank you. The limitations of this study that we only choose a stable angina patient. The sample size was only 29 and there was no control group. So it was a pilot study, so it was just a beginning. So there is far more to go ahead. Thank you.
I'm sorry, I didn't understand the third intervention. Can you describe that a little bit more?
Yeah. Sir, this one is a per-rectal drug administration, that is a basti. So in that we use a decoction or a kada as per the Ayurveda, and we put it per-rectally. So it gets absorbed per-rectally and gives its result. It's a medicated enema, you can say. It's not enema exactly, it's a medicated enema, but it is a kind of a per-rectal drug administration.
So another question, the intervention did not go to the, how long was the intervention? 7 days?
It was 7 days intervention.
7 days?
Yeah.
And they did not do the intervention between day 7 and day 30?
There was oral medication between them.
There was, sorry, what?
There was oral medications.
Okay.
Okay.
The last
Yeah.
one slide. Is this published?
Yeah, this data is already published in Journal of Clinical and Experimental Cardiology, and that we have already presented in the Clinical and Cardiological Conference USA last year, April 2014.
So is this a conference supplement issue or a main issue?
It's a supplement issue.
So abstract
Yeah,
was
abstract
as
was
published. Okay. You need to complete the reference.
Okay,
It's
fine.
just name of the journal is what it is there.
Fine, fine. Yeah. Sorry.
Okay. Thank you.
Thank you.
So before going ahead with the next one, I would like to request the audience to please switch off your mobile phones or put them on silent so that we don't disturb the presenters. The next one is Neela Tamhane, paper ID 56. Title is Effect of Yogic Practices in Improvement of Neuromuscular Coordination and Motor Skills in Leprosy Patients Suffering from Diabetes. The next one would be Shrikant Jayas. Please be ready.
Hari Om. Namaskar to my Guruji, Yogacharya Sri Krishna Vyavhari, and all of you. The topic is Effect of Yogic Practices in Improvement of Neuromuscular Coordination and Motor Skills in Leprosy Patients Suffering from Diabetes. Here in this project, we have taken camp of leprous people came out of leprosy, cured from leprosy, but suffering from diabetes. It was a very big challenge for us to conduct a camp for these people because of their some disabilities, their limitations and all. So, but yoga made it all possible, and as rightly said by Baba Amte, joy in Anandavan is much more infectious than disease itself. Really, we also got this infection of joy and joy in our work. Baba Amte is founded this community rehabilitation center for leprosy patients and the disabled for the downtrodden section of our society. It is located at Chandrapur in Maharashtra, near Varora. Baba Amte, as we know, was felicitated with many awards like Raymond Magsaysay Award, Padma Bhushan from our government, then Gandhi Peace Award, and so many awards were conferred upon him. Then this is our Guruji with Baba Amte. Baba Amte's daughter-in-law, Bharti Amte, invited and requested our Guruji to conduct a camp for diabetic people at Anandvan, and we have conducted it for 7 months from March to October. Initially there were 49 participants, but considering dropouts and the persons which are not suffering from leprosy, there were 36 participants, and we could get pre and post reading only for 21 participants who suffered from, came out of leprosy but suffering from diabetes. And the average age was 53, 12 male and 9 female participants were there. The inclusion criteria was of course of the sadhakas who were cured from leprosy and suffering from diabetes. And exclusion criteria, in this we have not excluded those other disabled people from our camp, but we have excluded them from our readings. And where the medical complications as retinopathy or like that, we have excluded them from our studies. That very first day assessment were done, and on the last day also of our camp. The yogic intervention that is simplified SDM module that is designed by S-VYASA was given to them. Then the daily 1 hour practice, 1.5 hour practice in the morning, 6 o'clock we were conducting, and apart from this, we have given training, SDM modules training we have given to yoga teachers from Anandavan and teachers from Anandavan school, so that they could conduct the class. When we stayed there for 10 days, and after that for 7 months they have conducted the class, and we have taken the readings at both the end. Our team went from Thane and we took the readings of them. Then these are the demography. All 21. Only 3 people were studied up to SSC, others are illiterate, profession also, farmer, sweepers, like that. The 21, all of them leprosy person suffering from diabetes. Out of that, 8 were having high blood pressure. Then 1 was HIV patient and other was suffering from arthritis also. This is simplified module of SDM, as we know, starting from Kapalbhati. We have included all these things: breathing exercises, Sukshma Vyayam, loosening exercises, Surya Namaskara, asanas, sectional breathing, SMED practices also we have given, but it is according to their abilities. We told them to conduct or practice it mentally if they cannot. Then these are the photographs which I want to show you to show that how they were doing, sitting in chair, or these are the how we have modified that according to their capabilities. This is Jyoti Tratak, DRT, Shavasana, sitting in wheelchairs and all. Just this is photograph of the teacher's training, loosening exercises, and the person sitting in chair he is doing. At the last day, he came out of that chair and practiced on the ground. I think this is the achievement of making this person, his legs and fingers, you must have noticed it in that. So parameters which we have taken, that hand steadiness test, hand grip test, finger dexterity test, fasting blood glucose, post-lunch blood glucose, HbA1c, and questionnaire. They couldn't read it, but we read out it for them and the answers. That is Sinha's anxiety test we have taken. Then assessment was done on the machines from Pune. Then this is hand steadiness test. Just observe her fingers. This is finger dexterity. Again finger dexterity. And this is the doctor, we met him in their hospital, and these are the results. In these results, you can very well see that the finger dexterity test, pins inserted, is significant. Then finger dexterity test, pin dropped out. This is not a regular parameter, but we have observed it, that they could pick up the pins very nicely. So motor skill is developed in them and the rate of dropping down the pins was significant. Then again fasting glucose, significant parameters are there. Post-lunch, I don't know, we didn't get any improvement in that, but HbA1c is significant in this. The questionnaire score and percentile, it is not significant, but p-value is 0.057, and as discussed with our statistician, we consider the statistical confidence limit at 90%, and anxiety test, hand steadiness test are because of that are significant. Then data was analyzed on SPSS 21 package, method use, this thing. These are the graphs which I have shown here, and in the discussion, incidences of diabetes associated with leprosy might have be due to stress of isolation. They were feeling so much, they expressed with us also, and non-acceptance from society. Their children were also not allowing them to enter in their villages also. Vascular and metabolic abnormalities in diabetes affected peripheral nervous system. Yogic practices have shown reduction in symptoms of anxiety. Then reduction in anxiety reflected in significant improvement in finger dexterity score. Abdominal breathing also helped in that. It may play an important role. This resulted, it may have resulted in improvement of neuromuscular coordination, fine motor skill, eye-hand coordination and attentiveness. So conclusion is anxiety plays major role in diabetes and in the leprosy patient also. And with reduced anxiety, we got significant result. And we think that we should continue this study for a more period and with more number. So this is books referred acknowledgement, and this is Baba Amte's Samadhi. It is, he found his soul, his God in the friend, that is leprous, and here we become speechless. And really, this is a very difficult task we have done over there, dealing with leprosy people and all. And it was a very good experience for us, changing our thoughts and our thinking. Thank you.
Thank you for good presentation. Madam, just wanted to know how long was this yoga camp? The camp?
7 months, madam.
7 months.
Yeah, 7 months. Because they were disabled people and they cannot do with us how we teach them and all, no? So we conducted it for 7 months. We taught there, our SDM module of S-VYASA, we taught the teachers, yoga teachers are there, 2-3 yoga teachers are there, so we taught them that.
So in between any analysis has been done, because 7 months is too long.
Yeah.
Maybe after 1 month or 2 months you
In
should.
the month of May, we have done analysis again.
That you are not presented here.
No, we have considered only 2 analysis.
And HbA1c, what is that's the actual value or the difference you have put?
What is that?
Glycated hemoglobin.
Huh.
You said 1.1 in the pre-post was 1.8.
Yeah.
What is that?
That is a significant value with that HbA1c. We got very good results in that. Pathology from their hospital.
No, is that a difference between the pre and the post?
Yeah, difference between pre and post. Yes.
Do you have any questions? Sir.
The number of people that you had starting the intervention and the number of data points you got from people is very different. So you had dropouts from people who did not complete the post.
Yeah.
And can you explain why you had so many dropouts?
Dropouts, they left from there, from Anandavan, and they sent for some work by that Anandavan, this thing. There's some work prior to this camp was allotted to them. So some group of people was sent out of Anandavan, so second reading we couldn't get. And there were people who were disabled, they couldn't do, the deaf or blind people, but with diabetes. They were attending our camp. We have not included them in our study. Madam Bharti Amte herself is a diabetic person, and she was also attending our camp for all the days. But we have excluded her from our camp, our readings and.
Do you have, I mean, this is not directly related to your presentation, but if you have this information, it will be useful to know, and also would have been nice to have it as a preliminary fact, the preface fact rather. What's the incidence of diabetes in leprosy patients? Do we have that data for India or for the state of Maharashtra? I'm not aware of that. Do you have any idea? You worked in this area?
I have gone through one reference, hence International Journal of Dr. Prasad.
It's okay. Give us the fact. Yeah. What's the
fact is lepromatous leprosy. In those, these are more prone to diabetes.
Do we have?
Yeah, 14%.
More than the general population?
General population, yeah. They compared it with general population.
Okay.
But because of the time lag and all, I couldn't put it there.
That's an important point that you should identify. And also if you can find out the cause why the 14% increase of incidence is there, there could be a region where yoga therapy can be of some use. So that's something that you should look at. Right?
Yes, sir.
And long time ago I had done project on tuberculosis patients, very difficult area. Congratulations, it's a difficult area to work with leprosy patients. You identified that, and don't leave it there. Please do a large sample study this is going to be a very good piece of data for all of us in clinical practice. Thank
They
you.
have invited us for their different
Good.
village and all, they are giving.
Sure. Please, thank you.
Thank you, Neela Tamhane. Yeah. So let us have a short break for tea, and let us be back within 20 minutes. All the delegates, please have your tea within 20 minutes and be back. And one more announcement, if you want to give your feedback, there are forms here. You can please take the forms from here and fill it up and return it to us. The tea is available just outside the hall. See, you can contact the person, and because see, only 7 people we have completed in more than 2 hours. So that's why. See, it will take a longer time. That's why we are not entertaining. Because